She saved 7 lives in 60 minutes. Then the FBI walked into the ER and asked for her by name. At Bayridge Medical Center in Norfolk, Virginia, it was supposed to be an ordinary rain-soaked morning. Coffee cooling at the nurses' station. Families waiting under fluorescent lights. Paramedics rolling in people who still had a chance. Then, the I-64 pileup hit like a war zone on wheels. 7 critical patients. 1 trapped surgeon. 1 rookie nurse standing in the trauma bay with blood on her sleeves and no fear in her eyes. But this is not just a hospital story. It is about the moment a person's hidden past breaks through the life they tried to build. Stay with me until the end, because what happened after the 7th monitor stabilized changed everything. Like the video and comment where you're watching from. Before the FBI badges flashed under the trauma bay lights, before 7 green lines trembled on 7 monitors, before anyone at Bayridge Medical Center whispered Mara Collins, like the name itself might draw trouble, the morning had begun almost gently. At 6:48 a.m., Norfolk sat beneath a hard coastal rain. Water ran down the hospital windows in silver ropes. The parking lot shone black beneath ambulance lights. Wind pushed mist sideways across the emergency entrance, making every person who came through the sliding doors look as if they had crossed a river to get there. Inside Bayridge Medical Center smelled like burnt coffee floor cleaner and the old fear that never fully left an emergency room. It lived in the chairs and the curtains, in the silence between monitor alarms. Even when the halls were quiet, the place carried the memory of people who had begged for one more breath. A security guard yawned near the entrance. A janitor dragged a mop bucket past radiology. 2 nurses leaned over the counter at the station trading complaints about night shift staffing and cafeteria eggs. Somewhere down the hall a child coughed. Somewhere else an old man called for his wife in a voice that had forgotten she was not there. Mara Collins entered through the staff door with her canvas backpack held close to her side. She did not rush. She did not linger. Her badge, clipped to her jacket, still looked new. The plastic was clear, the edges clean, the photo recent. Beneath her name were 3 words that made people expect mistakes. RN Residency Program. Most new nurses wore that label like an apology. Mara wore it like camouflage. She paused just inside the hall while the door sealed behind her. Her eyes moved once across the corridor, not wandering. Measuring. Camera above the vending machine. Reflection in the dark glass of the volunteer office. Exit sign at the west stairwell. Elevator doors polished enough to show movement behind her. A supply cart parked too far from the wall. A man in a gray hoodie sleeping in a visitor chair with both hands visible. Only then did she keep walking. The hospital around her yawned into shift change. Elevator chimes rang soft and bright. Rubber soles squeaked on the tile. Someone laughed too loudly near the coffee station, the kind of laugh people used when they had slept 3 hours and needed their own body to believe it was fine. Mara passed the coffee without touching it. A respiratory therapist pushing a cart glanced up. "Morning, Collins." "Morning." Her voice was even. Not cold, not warm, just placed carefully in the air. The therapist kept moving, then looked back once. Mara had already turned the corner. In the locker room, she changed into navy scrubs and tied her dark hair at the base of her neck with a plain black band. No earrings, no perfume, no bright shoes, nothing that could catch a swing snap or leave a trace. She tied her laces tight enough for the leather to creak, then pressed one palm against the locker door and listened. Pipes in the wall. Rain on the roof. A distant cart rattling over grout lines. No panic yet. She opened her backpack and removed only what she needed. Pen light, trauma shears, a small notebook. A folded photograph she did not unfold. She stared at it for half a second before sliding it back into the inner pocket. On her left forearm, just above the wrist, a pale scar curved beneath the edge of her sleeve. It was old, clean, smooth. The kind of scar that had healed better than the memory attached to it. When Mara stepped onto the emergency floor, Diane Holt was already at war with the day. The charge nurse stood behind the main station with a tablet in one hand and a phone pressed between her shoulder and ear. She was in her late 40s, compact, sharp-eyed, with hair pulled back so tightly it seemed to hold her whole face in place. There were people who managed chaos by raising their voices. Diane managed it by making everyone else afraid to waste her time. "No, I heard you," Diane said into the phone. "I also heard you say there are no beds upstairs, which is interesting because the patient in room 12 has been admitted for 6 hours and is still staring at my nurses like we built the hospital ourselves." She listened. Her expression did not change. "Then come downstairs and explain it to his daughter." She ended the call and looked up as Mara approached. "You're early." Mara stopped at the edge of the station. "Couldn't sleep." Diane studied her. New nurses usually say that like a confession. You say it like a weather report. It happens to people with night terrors or bad habits. Mara's face stayed still, sometimes both. For a moment, Diane's eyes narrowed. Not enough to be hostile. Enough to mark the answer and store it. "You're on Monitors Line's documentation. Trauma support only." "Yes, ma'am. No cowboy work." "I'm not a cowboy." That's what every cowboy says right before they put a boot through my morning. Mara almost smiled. The expression appeared and vanished so quickly it might have been a trick of the fluorescent light. Diane leaned closer. "Listen to me, Collins. Bayridge is not nursing school. This floor eats confidence for breakfast. You do the work assigned. You ask when you do not know. You follow chain of command." Mara nodded once. "I understand." Diane kept looking at her. "No, you understand the sentence. I need you to understand the cost." Mara's eyes did not move. "I do." Something in the way she said it made Diane go quiet. Not long. Diane Holt did not give silence more room than it deserved. "Trauma 2 needs restock check. Start there." Mara turned at once. "Yes, ma'am." Diane watched her walk away, then glanced toward one of the older nurses at the station. The nurse raised her brows. Diane muttered, "Too calm." The older nurse shrugged. "You complain when they panic, too." "I complain when they breathe wrong." "That one." Diane watched Mara enter Trauma 2. "That one listens like the walls talk." Trauma 2 was empty when Mara stepped inside. Empty did not mean safe. It meant waiting. The room was bright, scrubbed, and cold. A bed stood in the center beneath a hanging light. Cabinets lined one wall. The crash cart sat sealed beside the door. Oxygen and suction waited in silence. The floor still held a faint metallic scent no cleaner ever fully beat. Mara stood still for one breath. Then she began. She broke the seal on the crash cart and checked each drawer. Syringes, airways, medication trays, defibrillator pads. She tested the suction, then checked the tubing by hand. She traced the oxygen line to the wall and tugged the connection once. She lifted the bag valve mask and squeezed it, feeling resistance through her palm. She opened the airway drawer, pressed the laryngoscope light on, turned it off, then checked the batteries anyway. She moved without hurry, but nothing about her was slow. Dr. Noah Klein appeared in the doorway with a half-eaten protein bar in his hand and a tablet tucked under his arm. He was young, in the way residents were young after too much training and too little sleep. His white coat was clean enough to betray him. His stethoscope still had a shine. He had the tense confidence of someone who had learned a lot and had not yet learned how quickly a body could ignore all of it. He watched Mara for a moment. You always inspect a room like it might explode. Mara did not look up. Rooms don't explode. Noah smiled. Good to know. People do. His smile weakened. She placed the mask back exactly where she had found it. Noah stepped into the room. "I'm Noah Klein, surgical resident, trauma service this week." Mara Collins. "Yeah, I saw the badge." She glanced at him then, just once. He cleared his throat. "I didn't mean it like that. Most people don't." That sounded like forgiveness. It wasn't. Noah gave a soft laugh, unsure whether he had been insulted. Mara slid open the chest tube drawer and counted sealed kits. Noah leaned against the counter. "You prior military or something." Her hand stopped for less than a second. Then the drawer closed. Or something. Cryptic. Efficient. Do they teach that in residency? No. Where did you learn it? Mara picked up a roll of tape and placed it closer to the bed. From needing things to work. Noah studied her curiosity sharpening. Before he could ask more, a deeper voice cut through the doorway. Things usually fail when people assume they won't. Dr. Elias Vance entered Trauma 2 without hurry. He carried no tablet, no coffee, no wasted movement. His hair was dark with gray at the temples, his face lean, his eyes steady in a way that made people straighten before they realized they had done it. Vance had the kind of authority that did not need volume. He stepped into a room and the room remembered order. Noah stood a little straighter. Dr. Vance. Vance nodded, then looked at Mara, not at her badge, at her hands. They were relaxed, but ready. Close enough to the counter to reach anything. Far enough from the bed to see the whole patient if one were there. Her body was angled toward the door without seeming to be. "What are you assigned today?" he asked. "Support. Monitors lines documentation." "Good. Support keeps people alive." Diane appeared behind him, as if summoned by the possibility of someone being encouraged too much. As long as support remembers it is support. Vance did not turn. "Does she?" Mara met his eyes. "Yes, doctor." The answer was calm, respectful, precise. It still felt like she had left herself an exit. Vance noticed. Diane noticed that he noticed. Noah looked between them, missing half the language in the room and feeling the rest. Vance walked to the counter and picked up the bag valve mask Mara had tested. "You checked this?" "Yes." "Why?" "To know it works. Most people trust supply. Most people meet supply before the patient stops breathing." Vance's mouth moved slightly, not quite a smile. Diane folded her arms. "Collins." Mara looked at her. That kind of answer sounds clever until someone mistakes it for attitude. It was not attitude. What was it? Mara's eyes flicked to the empty bed. Experience. The room went still around the word. Noah looked interested. Diane looked suspicious. Vance looked as if a piece had moved on a board only he could see. Then the overhead speaker crackled with a routine page, and the spell broke. Vance set down the mask. "Keep the room ready." Mara nodded. He turned to Noah. "Rounds." Noah followed him out, but not before glancing back at Mara. Diane remained in the doorway. "You keep using words that do not fit your badge." Mara did not answer. "That is not a compliment. I did not take it as one." Diane held her gaze for another second, then left. By 7:40, the emergency department had filled with ordinary damage. A construction worker with a sliced palm wrapped in a towel. A woman with chest pain who kept insisting it was probably anxiety while her husband stood behind her looking terrified. A college student vomiting into a blue bag. An elderly man with pneumonia gray around the mouth, his daughter rubbing circles into his shoulder as if touch could pull air into him. Mara moved through the morning quietly. She started IVs cleanly. She adjusted monitors before alarms became problems. She spoke to patients in short, steady sentences that gave them something to hold. When the construction worker cursed at the needle, she said, "That means you are awake enough to complain." He blinked, then laughed, despite himself. When the elderly man gasped and reached for his oxygen tubing, Mara covered his hand with hers. "Slow. Let the machine help. You do not have to fight every breath." His eyes found hers. Panic loosened a little. Diane watched from the station. Noah noticed too. He saw that Mara never filled silence with fake comfort. She did not promise people they would be fine. She promised the next step, the next breath, the next thing she could control. At 8:12, Mara passed the ambulance bay doors and stopped. Outside, the rain had grown heavier. It slanted across the pavement in waves, blurring the red lights of an idling ambulance. Beyond the bay, traffic crawled on the street headlights smeared in the storm. A police cruiser rolled past slowly. Mara watched its reflection in the glass rather than the cruiser itself. Behind her, Diane said Collins. Mara turned. "Supply room. Pressure bags. Trauma 1 is low. On it." She moved down the hall to the supply room where the air smelled of plastic wrap cardboard and disinfectant. The fluorescent lights hummed overhead. She reached for the pressure bags on the upper shelf. Diane stepped in behind her. Mara did not turn. "You follow people quietly," Mara said. Diane stopped. "You hear quietly. I hear changes. What does that mean?" Mara pulled down 3 pressure bags and stacked them against her chest. "The floor sounds different before a bad hour." Diane stared at her. "A bad hour. Voices get shorter. Carts move faster. Radios go quiet. People start saving their breath before they know why." Diane's face tightened. "This is an emergency department, Collins. Bad hours come standard." Mara finally turned. "Not all bad hours are the same." The words were simple. The room felt smaller after them. Diane stepped closer. "I do not know what place taught you to talk like that, but here we have rules for a reason." "Yes, ma'am." "Do not yes, ma'am me if you are not listening." Mara held the pressure bags calmly. "I am listening." "Then hear this. Chain of command is not decoration. It keeps nurses from playing doctor residents, from playing heroes, and patients from becoming lawsuits with pulse rates." Mara's gaze stayed steady. "Patients are already at risk before the lawsuit." Diane's jaw set. "You think I do not know that?" "I think you know it better than most." The answer disarmed Diane for a fraction of a second. It made her angrier. "If you freelance on my floor, you put everyone in danger. Patients, staff, licenses, careers. You understand me." Mara looked at the shelves, then back at her. "If the chain holds, I follow it." Diane's voice dropped. "And if it does not?" Mara did not raise her voice. "Then someone still has to stop the bleeding." For a moment, neither of them moved. The hum of the lights filled the space between them. Diane pointed toward the door. "Take the bags to Trauma 1. Mara nodded and stepped past her. Diane watched her go, the frown returning deeper than before. In the main corridor, Dr. Vance stood near the physician workstation reviewing labs with Noah. He looked up as Mara passed. His eyes moved from the pressure bags to her face, then to Diane emerging from the supply room behind her. He said nothing. Noah did. "Everything good?" Mara kept walking. "Ask the floor." Noah looked at Vance. "What does that mean?" Vance closed the chart. "It means pay attention." At 8:37, the hospital seemed to inhale. The change was subtle enough that most people missed it. The waiting room television kept murmuring. The coffee still burned in its pot. Someone still complained about discharge paperwork. But the radios carried less chatter. A paramedic near the bay stood straighter while listening to his shoulder mic. A clerk at the desk stopped typing and looked towards a dispatch. Mara was at bed 9 taping an IV when she heard the first clipped phrase from the EMS channel. Multiple vehicles. Then static. Then another voice tighter. Bridge tunnel backup. Mara finished the tape smoothly. The patient, a woman with a migraine, looked at her. "Is something wrong?" Mara smiled gently enough to be believed. "Not with you." She stepped into the hall. Diane was already looking toward the ambulance bay. Vance emerged from Trauma 1. Noah stood with his tablet half raised, suddenly less sure what to do with his hands. The overhead speaker cracked to life. Bayridge Medical, prepare for incoming multi-casualty incident. I-64 eastbound near the Hampton Roads Bridge Tunnel. Multiple critical injuries. First units estimated 5 minutes. The emergency department changed shape. Conversation stopped. Chairs scraped. Curtains snapped closed. A nurse ran toward the blood bank phone. Respiratory was paged. Security moved families back from the corridor. Diane's voice cut through the room like a blade. Trauma, 1, 2, and 3 open now. Get warmers ready. Call blood bank and tell them I want emergency release standing by. Noah find Vance and stay with him. Collins monitors and lines. Support only. Mara pulled gloves from a box. "Yes, ma'am." Diane pointed at her. "I mean it." Mara tugged the gloves into place. "I heard you." Vance passed her on the way to Trauma 1. "You ready?" Mara looked toward the ambulance bay doors. For a breath, the rain outside sounded like rotor wash against canvas. Then it was only rain again. "Yes, doctor." Noah jogged in behind Vance, trying to look prepared. "How many are we getting?" Diane answered from the station. 7 confirmed critical. Maybe more walking wounded behind them. Noah's face changed. 7. The word seemed too big for the hallway. Mara moved to Trauma 2 and checked the suction again, though she already knew it worked. She raised the monitor volume 1 notch. She shifted the airway cart 2 feet closer to the head of the bed. She placed 2 pressure bags within reach. Noah watched her from the doorway. You said 4 if they're scared. Mara did not look at him. What? Earlier. You said something about 4 minutes. She opened a drawer and laid out IV supplies. 5 minutes is dispatch. 4 minutes is fear. Noah swallowed. Outside, the first siren rose through the rain. Low at first, then louder, then joined by another. The sound rolled toward the hospital, swelling until it pressed against the walls. Diane shouted, "Positions." The ambulance bay doors slid open. Cold, wet air rushed in. A paramedic appeared, first soaked through, face pale beneath rain and sweat hands locked on the stretcher rails. Behind him came the first patient, gray and bleeding, into the sheet. The wheels hit the threshold hard. Mara looked once at the man's chest, once at his throat, once at the monitor waiting dark beside the bed. Her hands did not shake. The paramedic shouted over the sirens. Male, late 30s, blunt chest trauma. Pressure dropping, breath sounds diminished right side. Noah stepped forward with his tablet. Diane yelled for Trauma 1. Vance moved to the head of the bed. Mara reached for the airway drawer before anyone asked. Then the second stretcher appeared behind the first, and the third behind that. The ordinary morning vanished under the sound of wheels rain and people trying not to die. The first stretcher hit the trauma bay so hard the metal frame rattled. Rainwater sprayed from the wheels and streaked across the tile. The paramedic at the head of the bed was soaked through his jacket, his face pale beneath the red wash of ambulance lights. Male, late 30s, he shouted. Blunt chest trauma. Pressure dropping. Breath sounds diminished on the right. We had him talking 2 minutes ago. The patient's name was printed on a damp driver license, taped inside a plastic bag. Anthony Bell. His lips had gone blue at the edges. His eyes were open but unfocused, staring past the ceiling lights like he could see something farther away than the room. His chest rose unevenly, one side fighting the other, barely moving. With every breath, the veins in his neck stood harder against the skin. Dr. Elias Vance moved to the head of the bed. "Anthony, can you hear me?" The man's mouth opened. No words came out, only a thin, wet sound. Noah Klein stepped beside the monitor tablet under one arm, trying to translate panic into process. "Get a portable chest film. We should take him to CT once his pressure allows." Mara was already at the drawer. She pulled out the decompression kit and placed it on the tray beside Vance. Noah glanced at her. "We do not know that yet." Mara looked at Anthony's chest, then at the monitor as the oxygen number slid lower. "Yes, we do." Diane Holt's voice cut from the doorway. "Collins, support." Mara did not flinch. "I am supporting." Anthony gasped, his body arching slightly against the stretcher. The monitor shrieked. His heart rate climbed higher, frantic and useless, like a fist beating against a locked door. Vance pressed the stethoscope to the patient's chest, first left, then right. His face changed only a little, but Mara saw the decision before he said it. "Needle decompression, right side, now." Noah reached for the kit. His fingers slipped once on the packaging. Mara's hand came over his, not taking over, just stopping the mistake before it became one. "Slow down." His eyes snapped to hers. "Do not touch my hand. Then make it useful." Vance looked at Noah. "Listen to her." Noah's jaw tightened, but he did. Mara guided without grabbing 2 fingers at the landmark voice low enough that only he and Vance could hear. "Feel the rib. Do not chase the panic. Find the space." Noah inserted the needle. A sharp hiss cut through the noise. Anthony's chest eased. The oxygen number paused, then began to rise 1 point at a time. His eyes rolled toward Mara, still terrified but no longer drowning as fast. Vance said, "Good, chest tube kit." Mara already had it open. Noah stared at the kit, then at her. "How did you know where it was?" Mara tore open sterile packaging. "I checked the room. That is not what I meant. I know. Before Noah could answer, the second stretcher slammed into Trauma 2. The woman on it was young, late 20s. Dark hair plastered to her cheek with rain and blood. A paramedic held pressure against her abdomen with both hands, but the blood had already found its way through the gauze. Claire Benson, the paramedic, shouted. Driver's side impact. Abdomen rigid. Pressure unreadable twice. She keeps fading. Claire's eyelids fluttered. Her lips moved soundlessly. Diane pointed hard. Trauma 2. Move. Mara crossed to the bed as Claire was transferred. She did not look at the chart. She looked at the skin, the lips, the fingers, the way the body had begun to pull heat back toward the center because it knew there was not enough blood to warm everything. Mara pressed 2 fingers to Claire's wrist. Thin pulse, too fast, almost gone. Warm blood, Mara said, now. Diane turned. You do not call massive transfusion on your own. Mara's gaze stayed on Claire. Then call someone who can before she runs out of blood. Noah appeared between the bays, still carrying the adrenaline from Anthony. We need ultrasound, maybe CT. Mara looked at him then. Her pressure is disappearing under your maybe. Noah's cheeks flushed. You are making assumptions. She is making decisions, Vance called from Trauma 1, his hands already at Anthony's chest. I authorize emergency blood. Diane activate massive transfusion. Diane's mouth tightened. For 1 second, the charge nurse looked like she wanted to fight everyone in the room. Then she grabbed the phone. Blood bank, this is Holton ER. Massive transfusion for Trauma 2. Emergency release. Warmers ready. Claire's eyes opened halfway. Where am I? Mara leaned close. Bayridge Medical Center. You were in a crash. You are not alone. Claire tried to lift her head. My sister was driving behind me. Mara placed a hand on her shoulder. Right now, you breathe. That is your job. Claire's eyes filled with panic. My sister. Mara's voice stayed firm. You breathe. I will ask. The promise was small enough to keep. She looked to a paramedic. Any other female from her vehicle or nearby. The paramedic shook his head while stripping off gloves. Not in my unit, more coming. Mara looked back at Claire. We are checking. It was not comfort. It was a handhold in the dark. The third stretcher arrived without sirens around it, because the patient on it had no room left for noise. The man's chest was still. A medic straddled the lower rail doing compressions as the stretcher rolled. Another squeezed air into his lungs through a mask. The monitor attached to him showed a flat, cold line. We lost pulse on the ramp, the medic shouted. Got him back once on scene. Lost him again 2 minutes out. Unknown downtime before extrication. Diane pointed toward Trauma 3. Code team. Now. But the code team was not ready. They were split between the first 2 bays blood bank calls, airway carts, and the flood that had only started. The patient was transferred to the bed. For half a second, everyone looked at everyone else. Half a second was too long. Mara stepped in. Pads on. A nurse looked at Diane. Collins is not assigned to code. Mara's voice sharpened. Pads on? The nurse moved. Noah turned from Claire's bed. Mara, you cannot just run a code. Mara did not look at him. Then come run it. Noah took 1 step, then stopped as Claire's pressure alarm sounded behind him. Vance shouted from Trauma 1. Noah, stay with Claire. Diane, who is on compressions. Jensen, Diane said, moving fast. Respiratory is coming. Mara placed the pads, eyes sweeping the bed. Clear. The defibrillator charged with a rising whine. Hands came off the patient. Mara checked the room, every body, every finger. Clear. The shock hit. The man's body lifted from the bed and dropped back hard. The monitor stayed flat. Compressions, Mara said. Hard and centered. Do not get sloppy because the screen looks dead. Jensen started compression sweat already forming at his hairline. What is his name? Mara asked. The medic checked the tag. Paul Griffin. 42. Mara leaned near the man's ear while Jensen compressed. Paul, if you can hear anything, you stay close. Diane stared at her. You think he hears you. Mara reached for epinephrine from the tray. I do not know. That is why I say it. The medication went in. The bag rose and fell over Paul's face. The room narrowed to rhythm pressure air pulse checks electricity. Mara watched the monitor, not waiting for hope-only evidence. "Charge again," Noah shouted from Trauma 2. "How long has he been down?" Mara did not look away. "Long enough. That is not an answer. It is the only one I have." The defibrillator charged again. Clear. Another shock. The monitor flickered. Nothing. Then one narrow spike appeared. Then another. Someone whispered, "Come on." Mara held up one hand. "Do not talk him out of it." Another spike. Then a weak rhythm. Jensen kept compressions until Mara checked the pulse. There. Faint, but there. "He has a pulse," Mara said. "Keep him warm. Get another line. Watch him like he wants to leave." The nurse at the monitor exhaled like she had been underwater. Diane stepped closer, eyes hard and bright. "Who told you to take that code?" Mara stripped off one pair of gloves and pulled on another. "No one." Diane glanced at Paul's monitor. The rhythm held. Her voice lowered. "Do not make me choose between discipline and a pulse again." Mara met her eyes. "I hope you do not have to." A crash echoed behind them as the fourth stretcher came in. This one carried a boy, not a man. A boy old enough to drive and young enough that his fear still looked like childhood. His name was Landon Price, 17. Varsity jacket cut open. Rainwater in his hair. Blood at his mouth. His legs lay at an angle that made Diane's face go flat. Pelvic crush, the paramedic shouted. Pinned under dashboard, pressure falling. Cold extremities. "He keeps trying to sit up. I can't breathe." Landon gasped. Mara moved to him before anyone assigned her. His hands clawed at the sheet. "I can't breathe. I can't breathe." "You can," Mara said, placing one hand on his shoulder. "Your body is scared and it is shouting. Listen to me instead." His eyes locked onto hers. "Am I dying?" The room seemed to hear the question and hesitate around it. Mara did not lie. "Not while you keep your eyes on me." Tears mixed with rain on his face. "My mom is going to kill me." A nurse almost laughed, then swallowed it. Mara's voice softened. "Then stay alive and let her?" Landon gave a broken breath that was almost a sob. Noah came over, still shaken from Claire and Anthony. Pelvic binder. Then CT when pressure allows. Mara's fingers moved along Landon's abdomen, his hips, the bruising spreading low and dark. She saw the rotation of the legs, the cold skin, the pulse racing itself empty. "He needs blood with the binder." Noah nodded sharply. "We are already low. He is already losing." Noah's temper flashed. "You do not know that the pelvis is the source." Mara looked at him. "No, I know it is enough of a source to kill him while you look for a prettier answer." Diane stepped in with the binder. "Place it." Noah looked at Diane, surprised. She did not look away from Landon. "You heard me." Noah slid the binder under the boy. His hands were too fast, too high. Mara touched the fabric. "Lower." Over the greater trochanters, you are closing a ring, not wrapping a gift. Noah glared at her, then corrected. The binder tightened. Landon cried out. Mara leaned close. I know. Stay with me. Say your name." "Landon." Again. "Landon Price." "Good. Again." "Landon Price." His pressure began to climb slowly. Not enough, but some. Diane looked at the monitor, then at Mara. "Good catch." Mara did not look pleased. She looked for the next thing that could kill him. Across the bay, Anthony groaned as Vance placed the chest tube. Claire's bloodline flowed through the warmer dark red and fast. Paul Griffin's rhythm trembled but held. Landon whispered his name like a prayer. 4 lives still in the room. 3 more on the way. The 5th patient arrived with a towel around his head and blood soaking through it. Owen Ward. Mid-40s. Truck driver. Unequal pupils. Shallow breathing. Chest bruising. One arm bent wrong beneath the splint. His breath came wet and irregular, like something inside him had forgotten the pattern. Noah stepped toward him with the urgency of someone desperate to regain control. "Head trauma. We need CT." Mara watched Owen's jaw slacken, then tighten. His oxygen dipped, his pressure sagged, His chest barely rose. He will not survive transport. Noah snapped without looking at her. Do not start. Mara moved to the head of the bed. He needs airway support here. We need imaging to know what we are treating. If he stops breathing in the elevator, the image will not matter. Noah turned on her. You are not a doctor. Mara's face stayed calm, but her voice changed. It became colder, not louder. No, I am the person watching his pulse disappear while you defend your plan. The words hit Noah harder than a shout. Vance looked up from Anthony's bed. His eyes moved quickly. Owen's breathing. Monitor, skin, chest movement. Noah's posture. Mara's hands ready at the airway cart. Stabilize here, Vance said. Noah looked as if he had been cut open in front of the room. Yes, doctor. Mara handed him suction. He took it. Respiratory arrived, breathless hair escaping from a cap. What do we have? Mara answered before Noah found his voice. Head and chest trauma. Pressure fragile. Airway failing. Bag slow. Do not overventilate him. The respiratory therapist looked at her badge, then at Noah. Noah swallowed. Do what she said. That was the first time he surrendered without being forced. Mara noticed. She gave him nothing for it. Owen gagged. Blood pooled in his mouth. Suction, Mara said. Noah cleared the airway. His hands were steadier now because Mara's voice gave the room a track to run on. Vance came in as soon as Anthony was stable enough for another nurse to manage. Status, Noah answered. Unstable airway. Head trauma. Pressure low. We are stabilizing before CT. Vance nodded. Good. The word landed on Noah like relief and shame together. They prepared the airway. Mara watched every dose, every movement, every number. Noah reached for induction medication. Mara said slow. His jaw tightened. I know. Then show me. He pushed slower. Owen's pressure dipped, but did not collapse. The tube went in on the second attempt. For 3 seconds, the room waited. Then the chest rose. Oxygen climbed. The respiratory therapist secured the tube. Noah let out a breath so deep it seemed to empty his whole body. Mara checked the pupils again. Still unequal. He can go when the hallway can keep him alive, she said. Noah nodded. No argument this time. At 9:31, the trauma bay had become something less like a hospital and more like a field station dragged indoors. The floor shone in patches where blood mixed with rain. Wrappers piled under carts. The air was warm from bodies, machines, and fear. Voices overlapped, but the noise had pattern now. Diane controlled the flow from the center of it all, moving nurses and equipment with hard little gestures. Vance traveled between beds like a man holding 7 doors closed with 2 hands. Noah followed orders faster than pride could stop him. Mara moved everywhere the gaps appeared, not always at the center, often at the edge, replacing empty suction canisters, pulling warm blankets before someone asked, moving pressure bags, adjusting lines so they would not snag, looking at monitors as if the numbers were only the surface of a deeper language. Diane saw it. So did Vance. So did Noah, though he hated himself a little each time he looked for her before deciding. The 6th patient came in at 9:37. Her name was Vanessa Lake, 31. Passenger in a rideshare. She had been conscious when EMS loaded her, then confused, then combative, then silent. A bruise spread across her temple. Her left hand twitched against the sheet. Head injury, the paramedic said. Possible internal trauma. She seized once in the rig short duration, no meds given. Vanessa's eyes rolled toward the ceiling. Mara saw the tightening before the seizure took her. Clear the rails. Noah turned. What? Vanessa's body locked. Her jaw clenched. Her arms pulled tight. The monitor erupted. Seizure, Diane barked. Protect her head. Noah grabbed the bed rail. We need neuro. We need CT now. Mara was already at the medication drawer, but she stopped before pulling the vial. She had crossed lines all morning, with permission arriving just in time. She knew exactly how thin the ice was. Dr. Vance, she called. Vance was across the bay with Claire, whose pressure had begun to slide again. Talk to me. Vanessa Lake. Active seizure. Pressure soft. Need benzodiazepine. Slow push. Vance did not look up. Dose it. Slow. Noah confirms. Noah stared at her. Mara stared back. Confirm. He blinked, then checked. Confirmed. She administered the medication. Vanessa's seizure continued for a few awful seconds, then loosened. Her body settled. The monitor slowed. Her breathing came ragged but present. Noah looked down at the vial, then at Mara. You waited. Mara checked Vanessa's airway. Yes. Why? Because this time waiting would not kill her. He absorbed that. The distinction mattered. It had always mattered. He was only now beginning to see that Mara was not against protocol. She was against using it as a blanket while people bled underneath. Diane appeared at the foot of Vanessa's bed. Transport says CT can take 1 in 6 minutes. Vance looked across the bay. Owen first, if his pressure holds. Mara said, he needs controlled movement. No hallway stops. Noah nodded. I will go with him. Mara glanced at him. Then watch the bag, not your phone. He almost snapped back. Then he did not. I know. Good. At 9:45, the first 5 patients were no longer actively dying. That was not the same as safe. Anthony's chest tube was draining. Claire was holding pressure only because blood kept flowing into her. Paul Griffin's rhythm looked like a candle in a draft. Landon's binder was buying time, not solving the bleed. Owen was ventilated, still unstable, waiting for CT. Vanessa lay sedated but breathing. The room had not won. It had only refused to lose quickly. Then the 7th stretcher came in. The paramedics moved slower with this one. That frightened Mara more than speed would have. People rushed when they believed there was still time to steal. They moved carefully when every inch might be the one that ended a life. The man on the stretcher was broad-shouldered, maybe 40, maybe older beneath the swelling. One eye was nearly shut. His jaw was bruised. His chest was wrapped tight with dressings already bleeding through. His left leg had been splinted. His abdomen was tense beneath torn fabric. Every breath sounded wet, dragged through damage. Unknown male, the paramedic said. No wallet found. Multiple fractures. Chest trauma, abdominal trauma. Airway compromised. Lost consciousness twice. Pressure falling en route. Mara approached the bed. The man's one open eye shifted beneath the swelling. It found her. His lips moved. At first, no sound came out. Mara leaned closer, keeping one hand at his jaw, ready to open the airway. He whispered through blood and breath. Black Harbor. The room did not hear it. Mara did. For the first time all morning, something moved behind her face. Not fear. Recognition with the blade inside it. Noah saw the pause. You know him. Mara straightened. I know he needs an airway. The answer came too fast. Vance heard that too. The unknown man's oxygen dropped. Respiratory moved in. Noah took position, but his hands had begun to shake again. Not badly. Enough. This patient was a disaster layered inside a disaster. Too unstable for transport. Too injured for delay. Too alive to give up. Too close to death to tolerate a mistake. Diane called from the station. We are out of open trauma bays. Vance answered without looking away. Then the room gets bigger. Mara moved the airway cart closer. Noah looked at Vance. I can intubate. Vance studied him for half a second. Yes, you can. Noah swallowed. Mara watched the patient's chest, the pulse at the throat, the gray under the skin. Low dose, she said. Slow push, keep pressure up. Suction first. Noah's pride rose by reflex. I know how to intubate. Mara looked at him. I know. That stopped him more than criticism would have. She was not insulting him. She was telling him the patient could not afford his fear. Vance stepped closer. Collins called the sequence. Klein executes. Noah's head snapped toward Vance. Doctor. Vance's voice did not rise. Do it. The room shifted. It was not official. It was not clean. It was not something a policy committee would admire. It was survival. Mara nodded once. 2 large bore lines. Warm blood ready. Pressure bag set. Suction on and in hand. Bag slow. Keep his chest moving, not his stomach. Noah, wait for the pressure. Do not chase the tube through a crash. Noah moved. The nurse on the left arm called line 1. Another nurse said lean 2. Diane shouted, blood is coming. The man's eye stayed on Mara. His lips moved again. Mara leaned just close enough. Stay quiet, she said. He rasped Doc. Her eyes hardened. Not here. Noah looked up. What did he say? Mara did not answer. Blood arrived. The warmer hummed. The pressure bag inflated. The man's oxygen slid lower. Respiratory squeezed the bag. Slow, Mara said. Give him time to receive it. Noah prepared the medication. His hand hovered. Mara watched the monitor. Now, slow. He pushed. The patient sagged. The pressure dipped. For one terrible moment, the line on the monitor seemed to lose confidence in itself. Mara's voice cut through. Blood faster. Vance, he is dropping. Vance was already there. Fluids open. Ready, with push dose pressing. Noah positioned for the airway. Suction cleared blood from the mouth. The first look was bad. Noah pulled back. I cannot see. Mara leaned in, not touching him. Breathe. Suction again. Lift, do not lever. He tried again. The room held still. The tube passed. Respiratory connected the bag. Nothing for 1 beat. Then the chest rose. End tidal respiratory called. Color change. Oxygen climbed. The unknown man's pulse steadied under Mara's fingers. Noah lowered his hands slowly. He looked wrecked. Vance clapped him once on the shoulder. Good tube. Noah nodded, but his eyes went to Mara. She had already moved to the abdomen. Rigid, she said. Diane appeared. Name. No-eyed, the paramedic said. We found a partial tag from his work bag. Maybe Miles. Last name unclear. The patient's eye opened again barely. Mara looked down at him. Miles. A tiny movement of the eyelid. Vance saw it. You do know him. Mara held pressure against a bleeding line. No. Vance's gaze sharpened. That was not no. Mara did not look away from the patient. It is the only answer I have time for. At 10:03 a.m., the last monitor steadied. 7 patients. 7 rhythms. 7 bodies that had come to Bayridge with death close enough to touch and had not yet crossed over. The trauma bay did not cheer. People in trauma did not celebrate early. They had seen too many patients punish confidence. But something changed. The noise thinned. The alarms became individual sounds again instead of one continuous scream. Nurses spoke in lower voices. Paramedics leaned against walls empty now that the motion had stopped. Diane stood at the center of the bay with a blood streak across one sleeve and her tablet forgotten somewhere behind her. Noah backed into the counter and sat down hard on a rolling stool. His hands trembled once. He closed them into fists. Mara saw and said nothing. That was mercy. Vance stripped off one glove. His other hand was still stained red at the wrist. He looked from Anthony to Claire, from Paul to Landon, from Owen to Vanessa, then to Miles. 7. Then he looked at Mara. No one had to say it. The room knew. Mara Collins had not saved them alone. Nobody saved anyone alone in a trauma bay. But she had seen each break before it widened. She had stepped into spaces where hesitation was gathering. She had turned panic into motion. She had made calls that should have belonged to people with more letters after their names, and somehow had been right too many times for luck. Diane walked toward her slowly. Mara was restocking gauze with blood drying at the cuffs of her scrubs. Diane stopped a few feet away. You disobeyed me. Yes, ma'am. You directed physicians. Yes, ma'am. You activated decisions you had no authority to activate. Mara placed the gauze in the drawer. Yes, ma'am. Diane stared at her. And if you had not done it, at least 3 of those people would be dead. Mara did not answer. Diane's mouth tightened. That does not make me less angry. No, ma'am. It makes me more angry. I understand. Diane looked at her for a long moment. No, Collins, I do not think you do. Across the room, Noah stood. His face had lost the flush of resentment. What remained was something more complicated. That was not nursing school, he said. Mara closed the drawer. Number. Trauma course. No. Flight nursing. No. Diane's eyes narrowed. Vance stepped closer. Where did you learn to move like that? Mara's gaze shifted to Miles behind the curtain. The 7th patient lay still sedated, ventilated alive. A drop of blood slid from the edge of the bed rail and struck the floor. Mara looked back at Vance. In places that did not have rooms like this, the answer did not satisfy anyone. It satisfied the moment. A clerk hurried in from the hall, face pale. Families are asking for updates. Diane turned at once, grateful for something she knew how to fight. Put them in consult rooms, one family at a time. Nobody comes back here until I say. The clerk nodded and vanished. Noah rubbed both hands over his face. Vance looked again at Mara. Collins. She met his eyes. He was about to ask a different question. Not where. Not how. Something closer to who. The automatic doors at the far end of the emergency department opened. Everyone heard them because for the first time in almost an hour, no stretcher was coming through. 2 people entered. Dark suits, dry coats, calm steps. They did not look like hospital administration. They did not look like family. They moved with the quiet purpose of people who expected doors to open and questions to wait. The taller one was a man in his 40s with close-cut hair and a face built for bad news. Beside him walked a woman with dark eyes, a tablet tucked against her side, her gaze already reading the room. Diane saw them first. This area is restricted. The man opened a leather wallet. The badge flashed under fluorescent light. Federal Bureau of Investigation. The room seemed to tighten around the words. Vance stepped forward, still in blood-stained scrubs. If this is about the highway collision, you can wait until my patients are stable. The woman looked past him. They appear to be stable because of her. Every head turned toward Mara. For the first time since the first stretcher came in, Mara's hands stopped moving. The male agent lowered his badge. Special Agent Warren Pike, this is Special Agent Elena Torres. Torres lifted the tablet. On the screen, lines of text glowed against a federal seal. Pike's voice stayed calm. We are looking for Mara Collins. Noah stared at her. Diane's face went hard. Vance did not move. Mara stood beside the open supply drawer, blood on her sleeves, her badge still clipped cleanly above the pocket. RN Residency Program. She looked at the agents as if she had been expecting them for years and hoping she was wrong. IMR. Collins. Torres tapped the tablet once. A name appeared on the screen. Not Mara's. Something older, something buried. Pike looked at her and said, "We need to ask you about Operation Black Harbor." The trauma bay went silent enough to hear the rain against the windows. Operation Black Harbor. The words did not belong in Bayridge Medical Center. They did not belong near the carts, the monitors, the warmed blood, the torn clothing stuffed into red biohazard bags. They carried the weight of another place. Sand, rotor wash, black sky. A radio voice cutting out halfway through a name. Mara Collins stood beside the open supply drawer with blood drying at her cuffs. Her badge still said RN Residency Program. Her face said nothing. Dr. Elias Vance looked at her first, then at the agents. What operation? Special Agent Warren Pike did not answer him. His attention stayed on Mara, steady and professional, but there was caution beneath it. He was not looking at her like a suspect. He was looking at her like a sealed door that had just opened by itself. Agent Elena Torres held the tablet against her side. "Miss Collins, we need to speak with you in private." Diane Holt stepped forward. "This is a hospital, not a federal office. She just worked a mass casualty." Pike nodded once. "We know." "No," Diane said. "You don't. You walked in after the blood stopped moving." Torres looked past Diane to the 7 occupied bays. "We read the incoming trauma log." Diane gave a sharp laugh without humor, then read the room. Vance pulled off his second glove and dropped it into the bin. His hands were still red at the edges. "If this is about patient care, you can speak with me." "It isn't," Pike said. "If this is about my nurse, you can still speak with me." Mara's eyes moved to Vance. "My nurse." The phrase landed strangely. Not ownership, not protection exactly. Something closer to a line drawn on the floor. Pike seemed to notice the shift. "She's not under arrest." "That's generous," Diane said. Torres looked at Mara. "We need 10 minutes. Mara finally spoke. "You never need 10 minutes. The agents both went still. Noah Klein looked between them, confusion sharpening into fear. Pike's voice softened. "Then you understand why this cannot happen in the middle of a trauma bay." Mara looked toward Miles Rourke behind the curtain. The 7th patient was sedated, ventilated, and alive. His chest rose under machine-assisted breath. Blood moved through tubing into his arm. He had said Black Harbor before the tube went in. He had not said it to anyone else. She turned back to Pike. "Where?" "There's a consultation room near administration," Torres said. Vance stepped forward at once. "I'm coming." Pike looked at him. "Doctor, this concerns classified federal material." Vance did not blink. "She concerns my hospital." Dr. Vance, Torres said, her tone controlled. "You do not want to be part of this unless you have to be." "I decide what I have to be part of." Mara looked at him. "Doctor." He turned to her. There was a warning in her eyes. Not fear. Calculation. She was measuring what his loyalty might cost him. He lowered his voice. "You saved 7 patients on my floor. I'm not letting 2 agents walk you into a room and turn you into a problem I'm not allowed to understand." For half a second, something human crossed Mara's face. It was gone before anyone could name it. "All right," she said. Diane came close enough that only Mara heard her. "Do not talk without counsel." Mara's mouth almost moved. "I've talked to worse people without counsel. That is not comforting." "No, ma'am." Mara followed the agents out of the trauma bay with Vance beside her, and Diane watching from behind like she was memorizing the scene for a fight she had not chosen yet. They moved through a corridor that seemed too clean after the trauma room. The farther they got from the bays, the more the hospital tried to pretend it was a normal building. Carpet near administration. Framed donor plaques, soft lights, a vending machine humming beside a poster that read, "Care begins with trust." Mara glanced at the poster once. Vance saw the look. Neither of them said anything. The consultation room was small with beige walls, a round table, 4 chairs, and a box of tissues placed in the center like a prop from another kind of tragedy. It was the room where doctors told families that surgery had failed, that hearts had stopped, that the world before the sentence and the world after it were not the same. Pike entered first. Torres followed. Mara chose the chair with its back to the wall. Vance noticed. So did Torres. Pike sat across from Mara. Torres remained standing with the tablet. Vance stayed near the door, arms folded, his white coat streaked near the cuff with someone else's blood. Pike placed his badge on the table. "For the record, this conversation is voluntary." Mara leaned back. "Then voluntarily tell me why Black Harbor is on your tablet." Torres's eyes sharpened. Vance looked at Mara. "You know what that is." Mara did not look at him. "Yes." Pike took a breath, careful with it. "At 9:12 this morning, your name appeared in Bayridge Medical Center's trauma documentation. At 9:16, a procedure note referenced needle decompression under mass casualty conditions. At 9:18, emergency blood activation. At 9:22, cardiac resuscitation with defibrillation. At 9:29, pelvic stabilization under shock presentation. At 9:38, seizure control. At 9:47, airway management under hemodynamic compromise." Vance's jaw tightened. "You're reciting medical care like evidence." Torres turned the tablet toward the table. It became evidence when the pattern matched a classified file. Mara looked at the screen. Rows of timestamps. Clinical entries. Her name attached in small print beside several notes entered by staff who had probably not thought twice before typing it. Mara Collins. The name looked ordinary there. That was the problem. Pike continued. "The alert did not trigger because you saved lives. It triggered because the method sequence matched archived operational reports connected to Black Harbor." Vance stepped closer. Method sequence. Torres tapped the tablet. A second column appeared heavily redacted. Field stabilization in low-resource combat environments. Delayed evacuation decisions. Hemorrhage prioritization. Airway control with pressure preservation. Patterned triage under simultaneous casualty load. Noah's words from the trauma bay seemed to echo in Vance's head. That was not nursing school. Mara's face remained still. Pike watched her hands. They rested flat on the table. You performed like someone trained in that system. Mara said people were dying. That is not an answer. It is the only one that mattered this morning. Vance looked from the tablet to Pike. You said classified. What exactly are you accusing her of? Nothing yet, Torres said. Vance's eyes cut to her, yet is doing a lot of work. Pike opened a folder he had carried under his coat. Not thick. Too thin for the weight it brought into the room. We ran her license. It's valid. Nursing school records are valid. Employment file is valid. Background check from Bayridge came back clean. Mara's expression did not change. Torres added clean enough to pass civilian hiring systems. Vance's voice hardened. What does that mean? Pike slid a printed page across the table. Mara did not reach for it. Vance did. It was a timeline. Dates, addresses, education, work history. Then a blank space. 5 years. No listed residence. No tax filings. No civilian employment. No medical records, no phone contracts. No credit activity. No driver record updates, nothing. Vance looked up slowly. Mara. She kept her eyes on Pike. People have gaps. Torres's voice was quiet. Not gaps this clean. Pike leaned forward slightly. Federal databases are messy. They overlap. They contradict each other. They keep things people forget they kept. When someone disappears completely, that is rarely an accident. Mara's voice was flat. Maybe I was good at being gone. No, Torres said. Someone else was good at making you gone. The room tightened. Outside the door, a cart rolled past. A wheel squeaked once every rotation, an ordinary hospital sound made strange by the silence inside. Pike opened the folder to the next page. Operation Black Harbor was a classified medical extraction mission attached to Joint Special Operations Support. Official records list the operation as failed. Casualties unrecovered. No surviving members confirmed. Mara stared at him. Vance felt his pulse pick up. Members. Pike slid a second document across the table. This one was heavily redacted. Most names were black bars. Dates were partial. Locations were blocked out. But one line near the bottom remained visible. Collins, Mara E. Status, Kaya presumed. Vance read it twice before the words made sense. Killed in action. Presumed. He looked at Mara as if the room had tilted. They think you're dead. Mara finally turned her eyes to him. No. Her voice was softer than before. They made me dead. No one spoke for a moment. Pike watched the exchange but did not interrupt. Vance's face had gone pale beneath the exhaustion. You were military. Mara looked back at the file. I was a medic. Torres's gaze sharpened. You were more than a medic. Mara said nothing. Pike spoke carefully. Special Operations Medical Detachment. Attached to missions that officially did not require medical personnel because officially they did not exist. Vance sank slowly into the chair beside Mara. The trauma bay had explained her hands. The file explained the silence behind them. Mara kept her back straight. Pike turned one page. The mission brief is sealed above our current access. What we have are fragments. Medical after action excerpts. Casualty movement logs. Extraction references. Black Harbor team members were declared lost after entering hostile territory. Mara's eyes stayed on the blacked-out lines. Vance asked, "Were you lost?" A small breath moved through her. "No," Torres said. Then what happened? Mara did not answer at once. Her eyes went unfocused, not drifting, but seeing through the wall into a place that had no beige paint and no tissue box. When she spoke, her voice was steady. We went in to bring people out. What people, Pike asked. Witnesses. Torres leaned forward. Witnesses to what? Mara's fingers pressed once against the table. Things men with flags on their shoulders wanted buried. Vance stared at her. You rescued them. We kept them breathing long enough for extraction. Pike looked down at the folder. Records say the operation failed. Mara's eyes lifted. Records say I'm dead. The answer sat between them. Torres shifted her weight. If Black Harbor succeeded, why erase the unit? Mara's mouth tightened. Because we came back with people who could talk. Pike and Torres exchanged a look. It was fast, but Mara caught it. She leaned back. You didn't come here to investigate me. Pike met her gaze. We came here because your name triggered an automatic alert. No, Mara said. That got you moving. It is not why you are asking these questions. Torres's expression remained controlled, but her hand tightened around the tablet. Pike folded his hands. Black Harbor has been locked for years. A presumed dead member appearing in a civilian trauma log is not routine. Mara's voice lowered. Who saw the alert? Pike did not answer quickly enough. There it was. Mara's eyes hardened. Who saw it? Torres looked to Pike. Pike said multiple systems received the flag. Which systems? Federal Law Enforcement Defense Archival Review Intelligence Oversight Channels. Mara gave a humorless breath. Oversight. Vance looked at her. What does that mean? Mara did not take her eyes off Pike. It means the people who buried the file may have just heard it move. Torres said, you think someone outside the Bureau monitors Black Harbor. Mara's expression went cold. I know someone does. Pike's tone shifted. Name. Mara stared at him. You say that like names protect people. They help us find them. They also help people vanish. Vance leaned forward, anger beginning to break through his shock. Hold on. You come into my hospital, tell me my nurse is listed as killed in action, then ask her to name the people who may have done it. Pike looked at him. Doctor, if someone with access to those old systems saw her name surface, your hospital could become a point of interest. Vance's voice went quiet. You mean a target? Pike did not correct him. Torres placed the tablet on the table. Ms. Collins, how did you obtain your current identity? Mara's face changed by 1 degree. Less open, less patient. I was born with it. You know what I mean. I know exactly what you mean. Torres held her gaze. The paperwork that brought you back into civilian life is almost perfect. Birth record, Social Security continuity, school transcripts, licensing pathway. Whoever rebuilt your life had access. Mara looked down at the file. No one rebuilt it. They left enough of the old one standing for me to crawl back into. Pike said, who helped you? Mara's voice was soft. People who are alive because they understood silence. Torres opened her mouth, but Vance spoke first. She saved 7 people less than an hour ago. Some of them are still unstable. If you have charges, say them. If you have protection to offer, offer it. If all you have is curiosity, get out. Pike studied him. This is not curiosity. Then what is it? Pike looked back at Mara. A warning that arrived late. The room went still again. Mara's eyes narrowed. You are afraid. Torres did not like that. We are cautious. No, Mara said. Cautious people do not bring old operation names into hospital hallways. Afraid people do that because the door is already open. Pike did not deny it. Before anyone spoke again, the door opened. Diane Holt stood there without knocking, face tight. Vance turned. What is it? All 7 are still alive, she said. Claire Benson is headed to surgery. Owen Ward is going to CT with respiratory and NOAA. Landon Price is holding pressure. Paul Griffin is unstable but present. Mara's eyes shifted at each name. Diane noticed. Then her gaze moved to the file on the table. She saw enough. Her voice cooled. Administration wants her. Vance stood. They can wait. They said now. Then they can learn disappointment. Diane looked at Mara. They're scared. Mara rose from the chair. That makes them fast. Pike stood too. We are not finished. Mara looked at him. You were not finished before you walked in. Torres picked up the tablet. Pike gathered the folder, but Mara's eyes stayed on the KIA line until he closed it. The consultation room door opened into a hallway that had already changed. News moved through hospitals without needing permission. It traveled in glances, half-sentences, phones turned face down too quickly. By the time Mara stepped out, 3 nurses stopped talking. A clerk looked away. A security guard at the end of the hall touched his earpiece, then pretended he had not. Vance walked beside Mara. Pike and Torres followed. Diane took the lead, cutting through the corridor with the force of someone daring the building to interfere. Administration had gathered in a conference room that looked designed to make fear sound reasonable. At the head of the table sat Lorraine Maddox, Director of Clinical Operations. Her silver hair was smooth, her suit was dark, and her hands were folded as if the meeting had been scheduled last week. Beside her was Hospital Legal Counsel Martin Greer, already typing notes. Human Resources sat with a file folder pressed shut beneath both palms. 2 unfamiliar men stood near the windows, not in uniforms, not in hospital badges, too still to be consultants, and too quiet to be harmless. Mara saw them immediately. Vance did too, because Mara did. Lorraine Maddox gestured toward a chair. "Ms. Collins, thank you for coming." Mara remained standing. "Who are they?" The 2 men looked at Lorraine. Lorraine's smile tightened. "Risk consultants." Mara looked at Pike. "Federal." Pike's expression gave nothing. One of the men near the window spoke. "Private." Mara's eyes moved across his suit, his shoes, his empty hands. "Private does not mean harmless." The man's smile was faint. "No, it does not." Vance stepped forward. "That's enough. What is this meeting?" Legal counsel adjusted his glasses. "We need to clarify several events that occurred during this morning's mass casualty response." Diane crossed her arms. "She saved them." Greer nodded. "The outcomes appear favorable." "Appear," Diane said. Lorraine lifted a hand. "We are grateful. Deeply grateful. But there are questions about scope of practice, authority, documentation, and the presence of federal agents in our emergency department." Mara sat. Not because they had power, because people often revealed more when they believed they did. Vance stood behind her chair. Diane stayed near the door. Pike and Torres remained just inside the room, silent observers with badges everyone could feel. Lorraine looked at Mara. "Ms. Collins, can you explain your prior training?" Mara answered, "I'm a registered nurse." "That is not what I asked." "It is the answer you can use." Greer leaned forward. "We need the answer that protects the hospital." Mara looked at him. "The hospital needed protection an hour ago." It got it. One of the private consultants moved away from the window. "Your skills are specialized. So are Dr. Vance's." Vance gave the consultant a hard look. The consultant continued. "Dr. Vance's privileges are documented through standard medical channels. Yours appear to come from another environment." Mara's voice stayed calm. "Patients do not bleed differently because the room has better lighting." Greer stopped typing. Lorraine folded her hands tighter. "Ms. Collins, this is not adversarial." Diane made a sound in her throat. Maddox ignored it. "We have to determine whether your continued presence creates risk." Mara held her gaze. "Today, my presence reduced it." The room had no good answer for that. Human Resources finally spoke voice thin. "There is also staff concern." Diane turned. "From who?" HR looked down at the folder. "There is confusion about command decisions." Diane stepped toward the table. My floor was drowning. Confusion was not caused by Collins. Confusion was caused by 7 criticals and not enough hands. Greer said, "Nurse Holt, no one is disputing the severity of the incident. You're sitting in a conference room disputing the person who kept it from becoming a morgue." Lorraine's expression hardened. "Diane." "No," Diane said. "You want clean language because clean language fits minutes and insurance notes." That hallway was not clean. Vance spoke then low and controlled. "If Mara Collins is punished for clinical judgment that saved lives under my authority, I will make that clear in every report this hospital asks me to sign." Greer looked at him sharply. "Dr. Vance, please be careful." "I'm being careful." Mara looked down at the table. She had not asked them to defend her. That made it harder to breathe than accusation. One of the private consultants looked at Pike. "Agent is Ms. Collins under federal restriction." Pike's eyes moved to him. No, under investigation. Pike paused. Torres answered first, subject to inquiry. The consultant smiled slightly. That is a flexible phrase. Mara looked at him. You know a lot about flexible phrases. His smile stayed. I know risk. No, Mara said. You know distance from it. The smile faded. Before the room could sharpen further, the door opened behind Diane. A young nurse stood there, face wet with tears she was trying to hide. Sorry, she said. I'm sorry, but the families are asking for the nurse. Lorraine blinked. What nurse? The young nurse looked at Mara. Her. No one spoke. The nurse swallowed. Landon Price's mother is outside the ICU doors. She says someone told her a nurse kept him awake. Claire Benson's husband is asking who called for blood. Paul Griffin's brother wants to thank whoever brought him back. Mara's face closed. No. Diane looked at her. Mara. No, Mara said again, quieter. Let them see their people. The young nurse looked helpless. They already know your name. Mara stood. Greer started to object. Vance stepped in front of him before the words came out. Do not. Mara left the conference room. The hall outside the emergency department was full of the aftermath. Families clustered in pockets held upright by coffee shock and each other. A woman in a raincoat stood barefoot because she had run from her car without shoes. A man leaned against the wall with both hands over his mouth. A teenage girl sat on the floor, staring at a phone that kept ringing. When Mara appeared, the air shifted. Not because everyone knew her, because grief and hope have a way of finding the person at the center of the room. A woman broke from the group near the ICU doors. She was in her 40s, hair damp from the rain, face destroyed by the kind of fear that leaves bruises no one can see. Are you Mara? Mara stopped. The woman's hands trembled. My son, Landon. They told me his pressure was falling. They told me he kept asking if he was dying. Mara's throat moved. He stayed with us. The woman covered her mouth. A sob came through her fingers anyway. They said you made him say his name. He did the hard part. The woman shook her head and reached for Mara's hand. Mara let her take it. Those same hands had held pressure, guided needles, placed lines, cleared airways. Now one of them was trapped between a mother's palms. Thank you, the woman whispered. Thank you for not letting him be alone. Mara looked at the woman's hands around hers. For a moment, the hallway became somewhere else. A younger face. Dust on eyelashes. A voice calling for a mother in a language Mara barely understood. Her own hand pressing down hard while blood warmed her fingers. Then the hospital came back. Mara said, When they let you in, talk to him. Even if he's sleeping. Tell him where he is. Tell him he is safe. Is he? Mara looked toward the ICU doors. He is here. The woman understood the honesty and nodded through tears. Behind her, another family stepped forward, then stopped, unsure if gratitude had a line. Mara could not take all of it. She stepped back. Diane appeared beside her, surprisingly gentle. I'll handle them. Mara looked at Diane. Diane's eyes were still hard, but not against her. Go breathe somewhere. Mara gave the smallest nod. She turned toward the quieter side corridor, Vance a few steps behind her. He waited until they were away from the families before speaking. You should have told me. Mara kept walking. What part? That the FBI had a file saying you were dead. I was hoping it would stay irrelevant. Vance let out a sharp breath. You thought being dead on paper was irrelevant in a trauma center. It was until this morning. He caught her near the window overlooking the ambulance bay. Rain still fell, though lighter now. Ambulances sat parked in the gray light, their red stripes dull under the storm. Beyond them, Norfolk traffic crawled through flooded intersections. Vance lowered his voice. Are you in danger? Mara looked at the glass. In the reflection, she could see him the hallway behind him, the corner near the stairwell. If I answer that you start making decisions like I am the patient, you might be. No. You are bleeding somewhere I cannot see. That made her look at him. He did not soften the words. I know trauma. Mara's eyes held his. So do I. The low security tone began before he could answer. It rolled through the hospital softly. almost politely. A pulsing sound meant to avoid panic while creating it in everyone who knew better. Vance turned toward the ceiling speaker. "What is that?" Mara did not move. Her eyes changed. Not wide, not startled, sharper. Diane appeared at the intersection, phone in hand, face pale beneath her command face. "Security alert. North parking structure." Torres came fast from administration, fingers pressed to her earpiece. Pike followed behind her, the folder gone, now his hand near his jacket. Torres listened, then looked at Pike. Unauthorized access. 2 security doors bypassed. Camera feed interrupted on level 2. Vance stared at her. In a hospital. Mara looked toward the north corridor. They did not come for the building. Pike's eyes locked on hers. "Who?" Mara's voice was quiet. "The people who made me dead." The words left Mara's mouth quietly, but they changed the hallway faster than any alarm could have. Dr. Vance looked from Mara to the north corridor where staff had begun to slow without knowing why. A nurse, pushing a medication cart, stopped near the wall. A security guard touched his radio and looked toward the stairwell. At the far end, an elevator chimed opened and revealed no one inside. The hospital held its breath. Agent Pike stepped closer to Mara. "How many?" Mara's eyes kept moving. Glass reflection. Doorway. Ceiling camera. Nurse station. Family waiting area. If they are smart, not many. Torres pressed 2 fingers to her earpiece. "Security says 1 guard is not responding near the parking connection." Vance's face tightened. "One of my guards is down." Torres did not answer quickly enough. Diane Holt came down the hall with a radio in her hand and fury in her eyes. "Somebody tell me what is happening in plain English." Mara turned to her. "Move the 7 crash patients." Diane stared. "Move them where?" "Different controlled access wings." ICU step-down post-op holding anywhere with limited doors. No 2 in the same corridor. Pike said, "We have not confirmed the target." Mara looked at him. "You do not breach a hospital after a trauma log alert unless the target is inside it." Vance looked toward the ICU doors. "The patients." Maybe Mara said. Maybe me. Maybe someone who saw something this morning. Diane's voice dropped. "Collins, if you are wrong, we create panic. If I am right and we wait, we create bodies." Diane looked at her for 1 hard second. Then she lifted the radio. "This is Holt. I need transport teams to ICU, trauma recovery, and surgical holding. Quiet movement only. No hallway announcements. Keep families with charge nurses. Nobody runs unless I say run." A nurse at the station looked up frightened. "Who authorized patient movement?" Diane turned. "I did." Mara reached for the second radio clipped near the desk. Diane caught her wrist. For a second their eyes met. It was not challenge this time. It was a handoff. Diane let go. Mara keyed the radio. "All units moving I-64 trauma patients, listen carefully. Keep monitors attached. Keep oxygen visible. Do not stop in public corridors. If a family member blocks you, give them 1 sentence and keep moving. If anyone asks where a patient is going, the answer is patient safety. Nothing else." The hallway began to move. Beds rolled out of rooms with controlled urgency. Nurses gathered IV lines and portable monitors. Respiratory therapists checked tubing. Orderlies pushed with both hands and pale faces. Families rose from chairs alarmed by the motion, but not yet panicking because Diane's voice filled the air like steel. Vance stood beside Mara and watched his hospital obey her. Not blindly, not because of rank, because the morning had taught them what her calm was worth. Pike spoke into his phone voice low. "Need federal support at Bayridge Medical Center. Possible classified exposure. Lock external access. Coordinate with Norfolk Police but keep hospital operations functional." Torres moved toward the north corridor. Mara caught her arm before she passed. Torres looked down at the hand, then at Mara. "Let go. Do not chase the obvious breach." Torres's eyes narrowed. "Why?" "Because they wanted you to find it." Torres held her gaze. "Then where?" Mara looked toward the older part of the hospital where the records wing connected to service elevators and utility corridors. Medical records, security feeds, anywhere they can find names faster than bodies. Pike heard and turned. They already have your name. Mara's face stayed still. Mine was never the only one. The radio on Diane's shoulder crackled. ICU to hold. Patient 7 is awake. Mara's head turned. Vance stepped closer to the radio. Repeat. The nurse's voice came again, tense and breathless. Patient 7 is awake. The unidentified male from the pileup. He is trying to talk around the tube. He keeps writing one name. Diane looked at Mara. What name? The line crackled. Collins. The hallway seemed to narrow around her. Pike's eyes sharpened. How would he know your name? Mara did not answer. She was already moving. Vance followed. Torres followed. Pike hesitated long enough to signal Diane, then came after them. They moved through a corridor that smelled of wet coats, antiseptic, and fear. Nurses pressed themselves to walls as the group passed. A child in the waiting area began to cry, not from pain, but from the adult silence around him. Mara did not run. Running made people look. Running turned fear into stampede. She walked fast, eyes cutting across every doorway. Near ICU, 2 security guards stood outside the double doors. One had his hand on his radio. The other looked too young to be standing between a hospital and whatever had entered it. Vance scanned his badge and pushed through. Inside, the ICU was brighter and colder. Machines breathed for people who could not. Pumps clicked. Monitors chimed. The staff moved with the careful quiet of a place where death was always close enough to be disturbed. Miles Rourke lay in room 7. Now that the swelling had settled slightly, his face had shape. Strong jaw, broken nose, gray at the temples. Bandages across his chest. Tubes and lines held him to the room. His one open eye tracked Mara the moment she stepped inside. The nurse at his bedside looked shaken. He keeps fighting the tube. Mara moved to the bed. Miles's fingers twitched against a clipboard. A marker lay beside his hand. On the page, written in jagged letters, was one word. Collins. Vance stared at it. Mara leaned over Miles. You should be sedated. Miles's eye creased at the edge. If he could have smiled, he would have. He tapped the clipboard with one finger. Mara took the marker from the nurse and placed it in his hand. His grip was weak. The letters came slow, crooked, and urgent. Still fast. Mara closed her eyes for half a second. Torres stepped closer. You know him. Mara opened her eye. He was attached to Black Harbor. Pike's voice sharpened. As what? Miles scratched another word. Witness. The room went colder. Vance looked at Mara. You brought him out. Mara's gaze stayed on Miles. We brought out several. Miles's hand moved again, but his strength failed. The marker slipped. Mara caught it before it hit the floor. His heart rate climbed. The ventilator alarm chirped. The nurse reached for sedation. Mara raised one hand. Wait, he's trying to tell us something. Vance stepped to the monitor. Pressure is soft. Mara looked down at Miles. His veil here. Miles's eye changed. That was answer enough. Torres touched her earpiece. Pike. Pike was already on his phone. Say the full name, Pike said. Mara did not look away from Miles. Adrian Vale. Torres went still. Vance noticed. You know that name. Pike's face had changed. Not fear, exactly. Recognition under restraint. He is not Bureau. Then what is he? Vance asked. Torres said oversight. Mara's mouth tightened. That is what he calls it. Miles's heart rate rose again. His hand clawed weakly at the sheet. Mara leaned close. Where? He forced his hand toward the clipboard. This time Mara guided it only enough to keep the marker steady. Records. Then below it another word. List. The monitor gave a sharper alarm. Vance moved in. He is done talking. Miles fought to turn his eye back to Mara. She put her hand on his shoulder. You did enough. He blinked once. Vance adjusted medication. The nurse checked the lines. Miles's body eased slowly, but the room remained tight. Pike turned toward the door. Torres' records wing. Mara stepped in front of him. No. Pike stopped. Move. If he wrote records, Vale already planned for you to go there. Pike's jaw flexed. You have a better suggestion. Yes. Lock down records, but send people to the service elevator behind sterile processing. If Vale is inside, he needs a clean path out. He will not use the hall with cameras unless he wants to be seen. Torres studied her. You know how he moves. Mara's voice was low. I know how he teaches people to move. Vance looked at her. That sentence cut deeper than the rest. Pike made the call. Security SEAL Records Wing. Norfolk PD to North Exterior. Federal units to service corridors. No shots unless direct threat. Repeat, hospital environment. They left Miles under guard. In the ICU corridor, Diane was waiting. 2 patients moved, 3 in transit. Claire is in the OR. Landon's mother is threatening to follow the bed. Let her see him from the doorway, Mara said. Then move him. Diane did not argue. What about the 7th? Guarded, Vance said. Diane looked at Mara. You look like you know the answer and hate it. Mara started toward the records wing. I know part of it. That is not comforting. It should not be. The records wing sat in the older side of Bayridge where the ceilings were lower and the lights hummed with age. The hallways narrowed there. The walls held framed photographs of the hospital from decades ago. Nurses in white caps, surgeons with serious faces, ribbon cuttings from a time when people believed buildings could keep promises. Now the corridor was empty, except for a single rolling chair tipped on its side. Torres crouched near it and touched the floor. Blood, not much, a smear leading toward the keypad door. Pike drew his weapon but kept it pointed low. Torres did the same. Vance stared at the blood, his hands flexing at his sides as if furious that he had nothing to clamp. Mara looked at the camera above the door. The small red light was off. Feed is cut, Torres said. Mara nodded. Not cut, held. Pike glanced at her. What is the difference? Cutting tells everyone where you are. Holding lets them think the system froze. From beyond the keypad door came a muffled sound. A body shifting, a shoe against tile. Torres moved to the side of the door. Pike signaled for the guard behind them to open it. Mara stepped back. Vance looked at her. What? He wants this door opened. Pike paused. Then a voice came from inside the records wing. Smooth, calm, familiar enough to make Mara's blood go cold. Still teaching people not to touch the obvious handle. The door clicked from the other side. It opened slowly. A man stood inside the records room beneath cold fluorescent light. He was tall, neatly dressed with a silver at the edges of his dark hair and a face too composed for an intruder. His suit fit like it had been made for him because it had. He held no weapon. His hands were visible. His smile carried the warmth of a man greeting an old friend at a private club. Adrian Vale looked at Mara Collins. There you are. Pike raised his weapon fully. Identify yourself. Vale turned his eyes to Pike with mild disappointment, as if the agent had interrupted a conversation. Special Access Internal Review, Adrian Vale. He reached into his jacket slowly and produced credentials. Torres looked at them first. Her posture changed. Not relaxed, worse, constrained. Pike saw it and lowered his weapon by a fraction, not because he trusted Vale, but because the badge in front of him complicated the act of aiming at him. Vance saw all of it. You have got to be kidding me. Vale's smile shifted toward him. Dr. Elias Vance, trauma surgery. Excellent work this morning. Vance's face went hard. Do not speak to me like we are colleagues. We are not, Vale said gently. You repair damage. I prevent scale. Mara stepped forward. You create damage and call the paperwork prevention. Vale looked back at her. For a moment, all performance faded from his face. Something almost tender remained. That made it worse. Mara. She did not answer. Vale looked at the blood on her sleeves, the tiredness around her eyes, the badge clipped to her scrubs. RN Residency Program. He read softly. That is almost funny. Vance moved closer to Mara. Vale noticed. Careful, doctor. Standing near her has a way of making people into collateral. Mara's voice dropped. You do not threaten him. I describe weather. No, you always describe choices after you remove them. Torres lifted her weapon again. Sir, you are inside a restricted hospital area during an active security event. You need to come with us. Vale sighed. Agent Torres, your supervisor is already receiving calls above your access. You can spend the afternoon being principled, but the paperwork will not love you for it. Pike's eyes stayed on Vale. Why are you here? Vale looked past him toward a wall of file cabinets and dark computer screens. Because a dead operation began breathing this morning. Mara took another step. You heard the alert. Everyone who mattered heard it. You mean everyone who buried it? Vale's smile thinned. There is that old bitterness. You left people in the ground who were not dead. I left names in the ground, Vale said. Bodies are more complicated. Vance stared at him. You erased a military medical unit. Vale finally looked irritated. I contained a compromise that would have eaten institutions alive. Mara's eyes hardened. You mean witnesses? I mean consequences. They were people. Vale turned to her fully. Yes, and people talk. They remember badly, they panic loudly, they tell partial truths to men who use them as weapons. You, of all people, should understand what one unstable survivor can do. Mara's jaw tightened. Miles is not unstable, no, Vale said. Miles is sentimental. That is more dangerous. Pike shifted. You came for the witness list. Vale smiled faintly. There is no list. Mara watched his eyes. There is. Vale did not look at her quickly enough. Torres caught it. So did Pike. Mara said, You do not know where all of them are. Vale's expression cooled. And you do. No. A small lie. Not complete enough. Vale studied her. You were always the fastest in a room. Not the strongest. Not the coldest. Fastest. You heard the first change in breathing before anyone else heard the gunfire. You could smell a bleed before the light found it. Vance looked at Mara, hearing admiration twisted into possession. Vale continued. I gave you a quiet life. Mara laughed once. It was small and empty. You gave me a grave with a paycheck. I gave you distance. You gave yourself deniability. Vale's eyes sharpened. You survived because I allowed it. The records room seemed to shrink. Pike raised his weapon again. That is enough. Vale did not look at him. Mara, you surfaced in a room full of witnesses, cameras, medical logs, and grateful families. Do you understand how much noise you made? I saved patients. You exposed architecture. I exposed myself. No, Vale said. You exposed the fact that Black Harbor was not a failure. Mara went still. There it was. The thing beneath the thing. Vance looked between them. Black Harbor succeeded. Vale's face returned to calm. Success is not always useful. Mara's voice was barely above a whisper. We brought them out. And then you brought out what they knew. They had names, dates, orders. They had enough fragments to burn people who should never have been visible. People who ordered civilians erased. Vale's smile vanished. Pike stepped forward. Say that again. Vale turned his head. No, Agent Pike, she will not. Mara held Pike's gaze. Black Harbor was sent to extract witnesses from a site that officially did not exist. We found survivors. We found records. We found proof that the operation we were supporting was not rescue. It was cleanup. Vance's face went pale. Vale's voice lowered. Careful. Mara looked back at him. I have been careful for 6 years. And people lived because of that. People hid because of that. They breathed. That is not the same as living. A radio crackled behind them. Diane's voice cut through strained. Vance, we have a problem. Landon price is dropping during transfer. Pressure is falling. We are in the East ICU corridor. Vance turned at once. Mara did too. Vale spoke softly. Do not. The word stopped Pike and Torres more than Mara. She looked at Vale. What? His smile returned, but there was no warmth in it. If you walk away from this room, you prove my point. Mara stared at him. A teenager was bleeding somewhere in the east corridor. Vale wanted her to choose the conversation. He wanted her to stand still. Vance was already moving. Mara followed. Vale's voice followed her. You never could resist a pulse. Mara did not turn back. The east ICU corridor was crowded with the staff around Landon's moving bed. His mother stood 20 feet away, blocked by Diane, sobbing without sound. The monitor on the portable stand screamed. Landon's face had gone gray again. His hands trembled against the blanket. Noah was at the bed, trying to manage the binder, the line, and the crashing pressure at once. When he saw Mara, relief flashed before he could hide it. He dropped when we moved him. Binder shifted. Pressure is crashing. Mara stepped in beside him. Hands. Noah moved without argument. She checked the binder placement, then the abdomen, then the line. Binder slipped high. Move it down. Tighten on my count. Blood faster. Warm blanket under him, not just over him. He is losing heat. Diane barked orders. Nurses moved. Vance checked Landon's belly and pulse. Landon's eyes fluttered. Mara, Noah said. I see it. She leaned over the boy. Landon, open your eyes. No response. Landon Price. Your mother is 20 feet away and furious. Do not make her come over here. His eyelids flickered. His mother cried out. Mara did not look away from him. Good. Stay angry if you have to. Angry is awake. Noah tightened the binder with her guidance. Landon groaned. The pressure stopped falling. Blood flowed faster. Vance looked at the monitor. Good. Keep moving. Straight to ICU. Mara stepped back only when the line steadied. Noah looked at her breathless. You came. Mara stripped off bloody gloves. He was dying. Noah nodded as if the answer had weight he had only just learned to carry. Behind them, slow applause sounded once. Then again. Not loud. Not from the staff. Vale stood at the far end of the corridor. No weapon. No hurry. 2 federal agents behind him, restrained by the complexity of his credentials and the crowd around them. He looked at Mara with something like pride. There she is. Mara's eyes went cold. Vale walked closer, unafraid of the officers, the nurses, the doctor, the mother still crying near the wall. Vance stepped into his path. You need to leave my hospital. Vale looked at him. Your hospital became relevant because of her. My hospital became relevant because people were hurt. People are always hurt, doctor. They only become useful when the right person touches them. Vance's fists tightened. Mara stepped beside him. I was never yours. Vale's gaze returned to her. No, you were better than that. You were the piece I should have locked away properly. Pike and Torres closed in from behind. Pike spoke into his radio. Federal support to East ICU corridor. Subject is Adrian Vale. Credentials under review. Do not allow exit. Vale sighed softly, still chasing doors. Torres said hands visible. Vale lifted both hands slightly. They are. The corridor's lights flickered once, not fully out. Just enough. Mara looked up. Pike did too 1 second later. Vale smiled. In the same moment, a fire door alarm sounded from the south stairwell. A nurse screamed somewhere near radiology. 2 security guards turned toward the sound. A family member stepped into the hall crying for his wife. Staff surged instinctively to protect patients. The corridor became motion. Vale moved into it. Not fast. Perfectly timed. Torres pushed through the crowd. Stop him. Pike shoved past an orderly. Vance tried to move, but a rolling bed cut across his path. Mara stayed still. She watched reflections. Glass panel, medicine cabinet, stainless steel elevator door. Vale was not running south. He had turned west, toward service elevators. Mara moved. She cut through an empty room, pushed past a linen cart, and entered the service corridor just as Vale reached the elevator alcove. He looked back, almost pleased. You always did choose the shorter route. Mara stopped 10 feet away. No more hiding behind systems. Vale pressed the elevator button. You think visibility saves you. It makes it harder to erase me. He tilted his head. For a while, the elevator opened. Inside stood 2 men in the hospital maintenance uniforms. not hospital maintenance. Mara knew it from their shoes. Pike appeared at the far end of the corridor.
Vale.
Vale stepped backward into the elevator. His eyes remained on Mara. You have something that belongs to Black Harbor. I have nothing. You do. You just have not found it yet. The doors began to close. Mara took one step, but one of the men inside shifted hand beneath his jacket, not drawing, only showing enough to make the choice clear. A hospital behind her. Patients behind her. Civilians everywhere. She stopped. Vale's smile softened. Still counting lives one at a time. The doors closed. Pike reached the alcove and hit the button hard. Too late. Torres arrived seconds later, furious. Service elevator is locked out. Mara looked at the floor indicator. Down. Then blank. He is gone, Torres said. Mara shook her head. He was gone before he opened the record store. Pike turned on her. What did he mean? What do you have? I do not know. Think. Mara's voice stayed calm, but the edges had sharpened. I said, I do not know. From the ICU corridor, Diane shouted for Vance. Another patient was moving. Another family needed calming. Another alarm cut through the air. The hospital had not stopped being a hospital just because war had found the door. Mara walked back toward Miles Rourke's room with Pike and Torres behind her. The guard outside Miles's door was still standing. The nurse inside looked relieved to see Mara, then frightened by the agents. Miles was awake again. Barely. His eye opened as Mara came close. She leaned over him. Vale came. Miles blinked slowly. His fingers moved. Mara put the marker back into his hand. It took him almost a minute to write. Cleaning list. Pike read over Mara's shoulder. What list? Miles's breathing grew rough. The ventilator alarm chirped. Vance entered behind them and moved to the monitor. Miles, Mara said, leaning close. Who is on the list? His hand shook. The marker dragged across the paper. Witnesses. The word looked broken. Mara's throat tightened. Miles forced one more line beneath it. You have first piece. His hand went slack. The monitor alarm sharpened. Vance moved fast. Pressure dropping. Get me norepinephrine. Check the chest tube. Mara stepped back. She did not move. Vance looked at her. Mara. She stepped back. The team surged around Miles. Hands lines, medications, numbers. The room filled with urgent voices. Pike held the clipboard. Torres stared at the words. You have first piece. Mara looked down at her blood-stained sleeves, at her badge, at the name that had dragged the past into the light. For the first time that day, she looked unsure. Not afraid. Unsure where the wound was. Vance worked over Miles' jaw tight. Diane appeared in the doorway, breathless. What happened? Mara looked at the clipboard in Pike's hand. Vale is not hunting me. Diane followed her gaze. Mara's voice lowered. He is cleaning up everyone Black Harbor saved. No one in Miles Rourke's room answered her. The words did not need an answer. They moved through the space like cold air through a cracked window, touching every face, every machine, every line running into Miles's body. Dr. Vance kept his hands on the patient. Pressure is still falling. Check the tube. I need another unit ready. The nurse at the pump moved fast. Diane Holt took one look at the monitor and stepped into the room as if rank had no meaning when a body was slipping. Tell me what you need. Vance did not look up. Blood. Warm blankets, respiratory at the door, and get his family status if we have one. Diane turned and barked the orders into the hall. Mara stood near the foot of the bed, still as glass. She had spent the morning moving before anyone else. Seeing the danger before it announced itself. Reading bodies faster than machines. But now the threat was not a collapsed lung or hidden bleed. It was a list. Names scattered across years. Survivors who had trusted silence to keep them alive. Miles had written 4 words. You have first piece. Pike held the clipboard in both hands. His face had lost its bureau smoothness. Torres stood beside him, eyes moving from Miles to Mara to the door, as if every wall in Bayridge had become too thin. Vance pressed 2 fingers to Miles's neck. There. Pulse is stronger. The room did not relax. No one in a hospital relaxed because one number improved. Mara finally stepped closer. Vance looked up sharply. I need space. He knows where the piece is. He is also trying not to die. Mara stopped. The words hit exactly where he meant them to. For a second, the past and present fought inside her. Black Harbor had taught her to gather the mission even while the wounded screamed. Bayridge had reminded her that the wounded were not obstacles to the mission. They were the only reason the mission mattered. She took one step back. Vance saw that she understood. Thank you. Miles's blood pressure climbed slowly, stubbornly. The medication caught. The bleeding slowed enough for the room to breathe again. His eye remained closed, but the monitor found a rhythm that did not sound like surrender. Diane returned to the doorway. North entrance is locked. Norfolk police have the public areas. Hospital security is covering ICU and surgical holding. Administration is losing its mind in 3 different rooms. Let them, Vance said. Diane looked at Mara. Media is outside. Mara's eyes shifted. How? Diane gave a dry, exhausted look. 7 critical patients. Federal agents locked down and half the city stuck in storm traffic. Hospitals leak faster than chest wounds. Torres looked to Pike. That means her name may already be moving. Pike folded the clipboard shut. Then we control exposure. Mara's gaze went to him. No. He turned. I did not make an offer yet. I heard the shape of it. Pike stepped closer, lowering his voice. Protective custody. Federal location. New name if necessary. We move you before Vale regroups. Vance looked at him. You are not taking her out of my hospital like equipment. Pike held up a hand. Doctor, this is not punishment. Mara said it is containment. Torres spoke carefully. It is survival. Mara looked at Miles on the bed. Then through the glass wall to the ICU corridor, where Landon Price's mother stood with both hands clasped under her chin, waiting for permission to see her son. Farther down, a man in a soaked jacket sat alone with a paper cup untouched between his palms. A nurse adjusted a blanket over a patient who would never know the name of the person who called for blood in time. Mara's voice was quiet. Survival is what people do when living is not available. Pike's jaw tightened. Vale has access. He has resources. He has people willing to walk into a hospital under federal response. I know. If you stay visible, he comes again. I know. Torres stepped closer. Then why are you arguing? Mara looked at her. Because disappearing did not stop him. It only gave him a cleaner story. The room went silent. Vance studied her face. He had seen shock wear many masks. Rage, laughter, calm, obedience. Mara wore clarity like a wound that had finally opened. Diane's radio crackled. Administration to Holt. Director Maddox wants Dr. Vance and Nurse Collins in conference room B immediately. Diane looked at the radio, then at Mara. You are popular today. Mara looked at Miles again. Vance nodded toward the nurse. He is stable enough for now. I have him. Mara hesitated. Vance's voice softened. Mara, I have him. She believed him. That surprised her more than the sentence. The conference room near administration was no longer trying to look calm. There were too many people inside, too many phones on the table, too many half-finished sentences. Lorraine Maddox stood near the head of the table with her arms folded. Legal counsel Martin Greer had abandoned his polished patience and now looked like a man hearing sirens inside his skull. Human resources sat pale and silent. The 2 private consultants were gone. Mara noticed that first. Where are your consultants? Greer answered too quickly. They left when the security alert escalated. Mara looked at Pike. Pike's face darkened. We will find them. Lorraine Maddox looked between them. Someone needs to explain whether this hospital is facing a federal threat, a military issue, a media crisis, or a patient safety event. Diane entered behind Mara. Yes. Maddox closed her eyes for one brief second. Diane. No, that is the answer. Yes. All of it? And while everyone keeps trying to name the fire, my floor is still moving patients. Greer leaned forward. Miss Collins, There are concerns about your presence here. Mara sat down. This time she did it because she was tired. Say them plainly. Greer took off his glasses. Federal agents arrived, asking for you. An unauthorized person entered a restricted wing. Your background is now uncertain. Media is gathering outside. We cannot ignore the possibility that you represent an ongoing risk to this facility. Vance stepped to the table. She also represents the reason 7 people are still alive. Maddox looked at him. No one is denying that. You are speaking like it is a footnote. It is the only thing keeping this conversation from going a very different direction. Diane gave a humorless laugh. You mean the families. You're afraid of what they say if you suspend her. Greer looked at Diane. This is not helpful. It is accurate. Noah Klein appeared in the doorway before anyone could respond. His white coat was gone. His scrubs were wrinkled. There was a faint smear of blood near his collar, and he looked younger than he had that morning. Vance turned. Noah. Noah looked at Maddox, then at Greer. I signed the note on Owen Ward. Greer frowned. This meeting is not about documentation. Yes, it is, Noah said. All of it is. You want to know who made the call not to move him to CT. I did. Mara looked at him. Noah's throat moved. She told me he would crash. I argued. Dr. Vance backed the decision. But I signed the note because by then I knew she was right. Greer, said Dr. Klein, you do not need to expose yourself legally. Noah's voice cracked, but he did not step back. He would have died in the elevator. The room quieted. Noah looked at Mara. I was angry because she saw it before I did. That is not a patient care problem. That is an ego problem. Diane's eyes flicked to him with something close to approval. Maddox sat slowly. Outside the room, voices rose near the hall. A woman crying. A security guard asking people to stay behind the line. The hospital was still breathing hard around them. Pike spoke from near the wall. The Bureau is not charging Ms. Collins. We are not asking the hospital to terminate her employment. Greer looked relieved for half a second. Pike continued. But her reemergence has activated classified attention beyond this building. I cannot tell you, there is no risk. Mara said, tell them the rest. Pike looked at her. She held his gaze. He exhaled. There may be other people at risk because of the same classified operation connected to Ms. Collins. At least one hostile actor has attempted to access hospital records today. Maddox's face tightened. Patience. Yes, Mara said. Greer turned to her. What do you mean, yes? Mara placed both hands on the table. The 7th patient is not random. He is connected to Black Harbor. Vale came here because the trauma log exposed me, and because Miles Rourke is alive. There are others like him. Lorraine Maddox's voice thinned. Others in this hospital. I do not know. Greer stood. That is not acceptable. Mara looked up at him. Most true answers are not. For a moment, Greer looked as if he might shout. Then Diane stepped closer to the table. You want acceptable, fine. Here is acceptable. Bayridge either treats the people in its beds, or it becomes a building that checks liability while patients bleed. I know which one I work for. Vance nodded. So do I. Noah said me too. The words were small. 3 people. 1 surgeon, 1 charge nurse, 1 resident who had spent the morning being corrected by the person he now defended. Mara stared at the table. She had lived years without allowing anyone to stand too close. Distance was cleaner. Distance meant fewer names to lose. But the room had already crossed that line. Not with speeches. With signatures, arguments, moving beds, standing in doorways. Maddox looked at Mara for a long time. What do you want? Mara almost laughed. No one in power had asked her that in years without already owning the answer. I want to work. Greer blinked. That is all. No. The room waited. Mara sat straighter. I do not disappear. I do not change my name. I do not let anyone walk into this hospital and decide which patients matter because of an old classified file. If I am here as Mara Collins. Pike watched her carefully. Maddox asked, And what does Bayridge get in return? My training. Greer's eyes sharpened. Formalized how? Vance answered before Mara did. Special Trauma Response Coordinator. Mass Casualty Readiness. Surge Protocol Review. High-Risk Transfer Training. She operates under physician oversight during active trauma events with clearly documented escalation authority, Diane added. And she trains my nurses to hear the floor before it screams. Mara looked at her. Diane shrugged. You do. It is annoying. It is also useful. Maddox turned to Greer. He looked like he wanted to object to everything. Then he looked toward the window where camera lights flickered beyond the rain at the hospital entrance. Formalizing responsibility may be cleaner than pretending none of this happened. Mara's mouth tightened. Clean is not the word. No, Greer said quietly, but it is what legal can build. Pike stepped away from the wall. This does not remove the need for protection. Mara looked at him. I know. Then we coordinate. Quietly. You inform us before leaving the city. You let us review any contact from Black Harbor names. You do not pursue Vale alone. Mara did not answer. Torres said, That last one was not decorative. Mara looked at her. I do not make promises I might have to break. Torres held her gaze. At least warn someone before you break it. That was the closest thing to trust either of them could offer. Mara gave one small nod. The meeting ended not with agreement, but with motion. That was how hospitals survived. No one solved the whole wound. They stopped the bleeding they could reach. Mara left the conference room with Vance, Diane, and Noah. The hallway outside was crowded with families, officers, nurses, and administrators pretending not to stare. When Mara stepped into view, conversations thinned. Landon's mother saw her first. She did not rush forward this time. She only placed one hand over her heart and nodded. Mara nodded back. Paul Griffin's brother stood near the wall, red-eyed and silent. Claire Benson's husband sat with his head-bowed wedding ring turning between his fingers. The lives from the trauma bay had spilled into the hallway now, not as cases, not as numbers, but as people attached to other people. Noah walked beside Mara for several steps before speaking. I meant what I said. I know. I am still mad you were right so often. That gets easier. He looked at her. Does it? No. He almost smiled. Diane stopped at the nurse station and picked up a clean radio. She held it out to Mara. Mara looked at it. What is that? Trouble on a clip. I already have that. Now it is official. Mara took the radio. Diane leaned closer. You still answer to me on my floor. Yes, ma'am. And if you do something stupid, I will write you up so hard the paper bruises. Yes, ma'am. Diane's expression softened by a fraction. But if the chain breaks, you speak. Mara's fingers closed around the radio. I will. Vance watched the exchange without interrupting. Then his pager sounded. He checked it. Miles is awake again. Mara moved before he finished the sentence. Miles Rourke looked smaller when she entered his room. Pain had carved him down to essentials. Breath, pulse, memory. His one good eye opened as Mara approached. Vance checked the monitor and gave them a little space, though not enough to pretend he was not listening. Pike and Torres remained outside the glass. Mara stood beside the bed. You scared everyone. Miles's mouth twitched around the oxygen mask. His voice came out rough and thin, still giving orders, still ignoring them. He made a sound that might have been a laugh if his ribs had allowed it. Mara leaned closer. You wrote that I have the first piece. His eye shifted toward the small personal effects bag on the counter. The nurse had placed it there after cutting away his clothes. Inside were scraps from his pockets, a cracked watch keys, a water-damaged work badge, and a folded strip of black fabric. Mara opened the bag carefully. Vance said gloves. She stopped, pulled on gloves, then continued. The black fabric was not fabric. It was a sleeve from an old field dressing packet. Sealed inside the torn lining was a small plastic chip no bigger than a fingernail. Mara stared at it. Miles whispered, not mine. Whose? He swallowed, fighting pain. Yours? Sent years ago. Could not reach you. Mara's pulse slowed. How did you know where I was? Miles blinked. Didn't, the piece did. Vance frowned. What does that mean? Miles's eye remained on Mara. Black Harbor split the proof. No one carried enough to kill everyone. Together enough to bury Vale. Mara closed her hand around the chip. Who has the rest? Miles's breathing roughened. Living. Names. His eye closed. Mara. Names. He forced his eye open again. Do not become him to beat him. The words landed harder than any list. For a moment, Mara saw Adrian Vale in the records room calm, and certain speaking of people as consequences. She saw herself this morning, moving from body to body, counting lives because no one else could count that fast. She put the chip into a specimen cup from the counter and handed it to Vance. Document chain of custody. Pike opened the door. We need that. Mara looked at him. You get it documented, copied, and witnessed. It does not vanish into a federal pocket. Pike met her gaze. For once, he did not argue. Agreed. Torres stepped in. I will sign as witness. Vance held the cup. So will I. Diane appeared in the doorway. So we'll have this floor if we need them. Miles closed his eye again, the faintest relief moving across his battered face. Mara touched his shoulder. You are still here. He whispered, barely audible. So are you. She stayed until his breathing evened. Later, the rain began to let go of Norfolk. Sunlight pushed through the clouds in thin, pale sheets. The ambulance bay glittered with standing water. Police cruisers still idled near the entrance. News vans remained beyond the barricade, their camera lenses pointed at doors that had seen too much already. Inside Bayridge, the work continued. Claire Benson was in surgery. Anthony Bell was breathing with a chest tube in place. Paul Griffin's rhythm held. Landon Price cursed weakly when his mother cried over him, which made everyone in the room cry harder. Owen Ward was back from CT, and not worse. Vanessa Lake slept under careful watch. Miles Rourke lived behind glass, guarded by people who no longer knew whether the danger outside was legal, federal, or personal. Mara returned to the trauma bay. The room had been cleaned, but not completely. It never was. A faint red line remained beneath the edge of a cabinet. Someone had missed it, or left it because the next shift was already coming. Mara stood in the center of Trauma 2. The same bed, the same lights, the same drawers. Different air. Noah passed the doorway, stopped and nodded once. She nodded back. Diane's voice rang from the station. Collins. Mara turned. Diane pointed toward the ambulance bay doors. Inbound fall from scaffolding, 2 minutes out. Mara clipped the radio to her scrubs. Vance walked up beside her. You ready? She looked through the glass doors at the wet, silver morning. Beyond the hospital, Adrian Vale was still breathing. Black Harbor was no longer buried. Somewhere other witnesses lived with pieces of a truth sharp enough to draw blood. But inside Bayridge, a patient was coming. That was the first thing. Mara looked at Vance. No, the siren rose. She pulled on fresh gloves. But I am here. The ambulance bay doors opened.